Hi, I'm Virginia from the Health Creators Podcast, where we talk about the impact and business of being a health creator. Here with me today is Dr. Tasha. Thank you so much for being here.
Oh, thank you for having me, Virginia. Really, really honored to be on this fantastic podcast.
Thank you so much. All right, so would you like to introduce yourself? So, what do you do, and what's your background, and what kind of content do you create?
Sure. So, my name is Tasha. I'm a breast cancer surgeon based in the UK, and I create content surrounding breast health and breast cancer.
Amazing. And so, did you start off creating content because you wanted to share health information, or what was your kind of inspiration to start creating videos?
So, it really stemmed from the acknowledgements of the fact that my time is quite limited in the hospital setting. So, patients would be asking me questions. And I would like to be able to give them in-depth answers, but the limitation of my time would mean that that's quite difficult to do. So that was, one aspect as to the reason why I started. Um, Another one was there's a lot of misinformation out there. You know, a patient would come up to me and say, "Oh, I read on Google that if you wear an underwire bra, then that increases your breast cancer risk," for example. And I would need quite a lot of time to say no, that's not true, and the reasons behind it, and all of that. But I don't have the time in clinic. So yeah, misinformation is quite rife, as you know. And I thought to myself, well, I am in a position to be able to combat that, and I actually felt the need to do that. So that was one of the other drivers. Um, and yeah, to be able to really signpost patients, initially, that was the aim, to reliable healthcare information. So somebody would ask, "Oh, you have no idea how to do a breast exam." Then I thought, okay, if I made a video of it, I could say, okay, I've got a YouTube channel, go to that channel. There are lots of videos about how to do that. So that kind of all stemmed from the need to be able to give more information that's reliable and accurate to my patients. And, I'm hopefully reliable, and hopefully I'm giving accurate information. So I'd rather them come to me and get my information rather than, blindly getting information off the internet.
I really like that. I also like that your videos are available to the public as well. So I really liked your video where you explain the metal clips that you get in your breast when you have a biopsy and how you have different ones so people know, exactly where the biopsy was taken and you have like dates on them. And I just thought that was so clever and it's just not common knowledge. And I
Yeah.
think I think that's the kind of thing that the kind of knowledge that you have that is so helpful for people to understand. And, having a metal clip in your breast, like basically for the rest of your life after that biopsy, is not harmful and providing that reassurance. So I really enjoy your videos. A big fan.
Thank you. No, I think you're absolutely right, because it's not just for patients. Ultimately, people who see me in clinic don't become patients of mine, which is great. I don't want patients. I don't want people to become my patients. I want people to come to see me, and I reassure them and send them along the merry way, hopefully reassured. So my aim is to educate the wider public, but also, for those who have had breast cancer, then they can also get information from what I provide. So, and yeah, trying to kind of figure out things that the wider public may not be aware of is also very important, I think.
Yeah, that's amazing. So, what's your kind of content creation process? Take me through from idea to maybe script writing and then putting the video together and publishing.
So, yeah, as you said, it's ideation always is the first, isn't it? So, I try to figure out what things people would want to know about. So, firstly, I guess I categorize them into those who have had breast cancer and those who haven't, who do not have breast cancer. So the wider public who are well, and those who've had a cancer diagnosis and have undergone treatment. And so I try to figure out the kind of information that people may want to know. Um, and that could be from what they have asked me about, what they have kind of DM'd me about, and also from my perspective, what I see would be an important thing to deconstruct, like that metal clip um, video, because a lot of people don't know about it. And a lot of people who've had biopsies may not know about the clip being there. Um, and actually, I got some feedback from somebody from that video saying, "Oh, I didn't know. You know, I had some kind of scans after that and didn't know why I had it. That's probably the reason why." So you get an idea, and I guess I just jot them down. I use notes on my phone, but anywhere you can jot things down. But that's what I use, and then I script it. And I think, as you know, scripting is probably the most time consuming. It is for me, anyhow. I don't know about you, Virginia, but it's definitely for me. And I do script it because in the past, when I was all just beginning to make content, and I guess this is YouTube specifically, long form content rather than social media content, I didn't script, and it just took me forever to shoot a video because I'll fumble my words and oh my gosh, I have to go back, stop it, and learning the hard way made me realize, okay, it's actually quite a good thing for me. I know people don't do that, and people kind of prepare their scripts in different ways, but I do script mine so that the shooting of the video, the filming of the video takes however long that video is, really. Invariably, it doesn't take too long. So yeah, scripting is the longest chunk of time that I actually spend on it, and then filming. So I'm lucky enough to have kind of a static setup, and I think if you can do that, that's great because it just removes all the faff. I do still faff about a bit, but I do have a static setup um, to a degree. But I have to get my SD card and all that, so and it's in a different room, so I do faff a bit, but it is a static setup. And then I'm lucky enough to actually get somebody to edit my videos. I would like to do it myself because I actually quite like editing, and I edit obviously my short form stuff, but I just don't unfortunately have the time to do that.
Brilliant. And so, what do you do after the video is published? Do you go back to read the comments and see the feedback, and then do you act on it?
Yeah, I do. I definitely try to get back into the comments and answer as many comments as I can. Now, obviously, as healthcare content creators, we have to be mindful of what we can and can't say on comments. So we can't be, providing advice, personalized advice to patients or to people in general, really. And that is a challenge, I have to say, because I get asked a lot about personal conditions and their own, say, diagnosis or their own conditions, their own symptoms, and they ask for my opinion. And I do have a disclaimer, but people don't really read disclaimers, to be fair. So they just expect an answer, and you just have to be mindful of providing answers to those questions if you should at all. Actually, I'm quite. I've been known not to reply, which I kind of feel bad about, but I can't reply to. It will be a stock reply. I can't provide personal advice,
Mm.
but I get so many questions about personal conditions that it is quite hard. But yeah, I do definitely try to answer comments that I can answer, definitely, because that's that's why you're I think why you're in on YouTube and why you're doing what you're doing, really.
Yeah, I would agree. I think just to backtrack, I do script my videos too. Whenever I try to freestyle it or riff,
It doesn't work.
it doesn't work. Exactly, perfect description. It does not work. You end up wasting like an hour or two
Yeah,
hours where it
it's
could have
too
just been.
painful.
It's so painful. Yeah, it could have just been a 5 minute video
Yeah, exactly.
filming session. Yeah. And I think also when you're responding to comments, I would agree that you want to avoid kind of commenting any kind of personalized advice. So I would say sometimes if you can, because one of the advantages of YouTube is you can click on links, you can actually copy and paste things to reputable websites and say, here's a link, you kind of signpost them to that so they can find out that information. And then also, um, I do the same thing. I try to answer the question, but then I always say, this is not advice for you to actually do this because I don't know your
Hmm.
situation and I'd need to have like a full consultation in order to give you that advice. So please like see your doctor, but
Yeah.
generally, you might want to consider doing this, but like definitely see your doctor. So, and obviously sometimes there are things where even with prescription medicines, I can only comment. I can say, this could be a side effect, but
Mm.
you need to see your doctor to
Yeah.
check.
Yeah.
And yeah, so there's a fine line between comments and giving advice, I think.
Yeah,
And yeah,
definitely. You have to be quite mindful about that, really. Yeah.
yeah. So we were discussing earlier before we started recording about views. So we have quite good uh, opinions on what should matter when you're
Mm.
creating a YouTube channel. So, what's your opinion on like getting views and people who are chasing a lot of views on their channel?
Yeah, I mean, I understand why views can be important for creators, because it's great, right? You create something and you want to have, as many views as you can on a video because there's a lot of hard work, blood, sweat, and tears, and all of that stuff. And it is a lot of work. And then if you only get a handful of views, it can be quite depressing and soul destroying. Personally, um, I don't, I don't, I don't kind of chase the views. Now, that might be right or wrong, but I'm not affected by the number of views that I get. And as we were talking before, I'm happy if I get, a couple of hundred views, and I'd be very happy also if I get a couple of thousand views. But either way, it doesn't really affect what I do because ultimately my aim and if we're talking YouTube specifically, my aim on YouTube is to provide information for the masses, and I make videos that I think may be helpful for people who may need that information. So I will go through certain topics, and I know, for example, I don't know, like I made a video about uh, male breast cancer. Now, I know that that is not going to be a topic that's going to be highly searchable, may not get many views either, but I feel it's important for it to be on my channel because that means that my channel will have the breadth of information that anybody who may want to learn about breast health can, they'll find a video on something. Um, so yeah, so whilst it's great to have lots and thousands of views, personally, I don't really chase views, and it's a pleasant surprise, to be honest. I'm pleasantly surprised if I've got many views, but I don't allow it to affect me that much, or at all, really. And I think YouTube is a long term game, right? So it's delayed gratification, if you will. I think if you want instant gratification, there are other platforms that can perhaps provide that, but I don't think YouTube is that. Well, it doesn't happen to me. I don't get I don't get viral videos on YouTube at all, and that's fine, because that's not what my aim is. That so yeah, that's how I view views, and it could be, you can argue it's a vanity metric as well. So yeah, I just don't get too fussed about views, to be honest. It'd be nice if I get more views, right? We all want lots of views, but um, I don't let it affect me too much.
Yeah, me too. I think the amount of effort it takes to get a view on YouTube is also higher because you need to have a higher quality video. And by high quality, I mean it needs to come from an authoritative source, which is you anyway, you're a doctor. So you already tick that box.
Mm.
And also, you give the actual information that people are looking for. So if they hang around to actually get what they want, then that is like a signal to YouTube to say, this is a high quality video, people are getting what they want, they're watching a lot of it. And I also think that collectively your videos together get a lot of views. So, for
Mhm.
example, my channel has, I don't know, I've just hit 1,000 subscribers recently.
Yay!
Yeah.
Yes! Woohoo!
Thank you. And 4,000 watch hours, which is like amazing.
Amazing. But you know, money's going to roll in.
I know, I know. I made 79 cents yesterday. That was my first YouTube payday.
You can nearly buy a coffee, just nearly, not
Yes.
quite yet. Half a coffee, not even that, I don't think.
I told my husband I could buy a chocolate bar. That's what I live on. I live on chocolate bars. Well,
Okay.
not daily. I mean, but they're a nice treat. It's nice to earn a chocolate bar. Do you know what I mean?
Yeah, absolutely.
So I think collectively, I get 35,000 views per month on my channel. So
Amazing.
yeah, thank you. That's
Wow.
yeah. So I think you're getting the views, you're just not getting them in one concentrated place. You're getting
Yeah.
them across your whole channel, which is just awesome. And your videos will often complement each other as well. So you can't give everything you know about breast cancer in one video. That video would be just
Yeah.
probably a year long. Yeah. Yeah. You never end filming it.
That's right.
So,
And nobody will be watching it past,
nobody wants
past
it.
the first 20 seconds.
You run out of characters in the description with the timestamps.
Yeah, that's it. Yeah.
So I think building a channel is like brick by brick, and I think people really appreciate choice as well, because if they find one video really informational and helpful, then they're likely to watch another one. And I think that's what counts. You want someone who's actually going to really value your expertise, because ultimately we're not entertainment channels, so we can't compete in that sense. I mean,
No.
there is like edutainment, education, entertainment.
Yeah.
So that's really interesting. So thank you for sharing that. I think it's good to have your why and your values and your purpose to keep you creating videos. And, those videos are ultimately going to be either shared with someone that you know, so you've made it for a purpose, which could be your future patient or your current patient. And then it saves you time as well. So you get
Mm,
to provide that personalized advice. So if your patient comes in educated because they've been watching your videos, then they're going to ask smarter questions as well.
absolutely. Yeah,
And
no,
I think
absolutely.
that's really valuable. Yeah. So, what would be your top tips for someone who wants to get started with creating videos?
Um, I think, just start really. I guess it depends on who's listening. There'll probably, broadly speaking, be two categories, right? There'll be those who are already doing it and those who are thinking about doing it. And for those who are already doing it, I would just say, consistency is quite important. But at the same time, don't be too hard on yourself, because ultimately, if you want to upload a video once a week, for example, that is, you have put that upon yourself to do, right? YouTube is not telling you, oh, you have to put one video out a week. Okay, maybe the YouTube gods might think that, okay, if you do it once a week, then you'll get more momentum and all of that stuff. But ultimately, you decide that, right? And so we hear a lot of creators burning out because it is quite a relentless process. And if you don't hit that target, which ultimately you set yourself, don't be too hard on yourself. Pare it down a little bit. Take a break. All of that stuff is so important, because one video a month is better than no video, rather than so yeah, that's my advice really. So be consistent if you can, if you're already doing it, but at the same time be mindful of not burning out, because we know lots of people do. And for those the other group who haven't started, just do it. I know we've all been there. I've been there. That there is that kind of fear of judgment. People are gonna be thinking about how, what on earth are they doing on YouTube? What do they know? That's the audacity of them to do such a thing. But people don't really care. People are way too busy with their own lives, doing their own thing. They're not really looking at you or judging you. And think about the knowledge and the wisdom that you can impart to those who may need it. And yeah, we all start at zero. Virginia's got 1,000, but she started at zero. We all start at zero. We didn't start at 1,000, so and just do it, and just do it scrappy, do it with your phone, And yeah, it's going to be not great. That's fine, but we all started not great. If you go to my old videos, they're terrible. But with iterations and practice, you'll get better. So yeah, if you haven't started, just start.
Yeah, I love that. And I think also there's a YouTube phenomenon where we were talking about it in the group chat where you post a video and nothing happens for like 500 days, even 1,000 days. And then all of a sudden it'll get all the views that
Yeah,
you've ever wanted.
amazing, right? Yeah, 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 yeah. And
Yeah.
you see those stats, and you get like I don't know, like a little emblem to say, oh, well done. There's like people have found your old videos, and more people are watching your stuff. So yeah, that's quite fun. But yeah, just if you haven't started, just start, because it's quite a fun thing to do, I think.
Yeah. And I think that you don't know unless you try, really.
Yeah, yeah, definitely. If you're thinking about it and you wonder what it's like, the only way to know is start, right? Because action creates clarity, right? You just do it, and you may hate it, and that's fine, and just then stop. It's okay.
Yeah, that's true. And then you pick it up again in 2 years when you find a
Yeah,
whole community is doing
exactly,
it. So,
exactly. Yeah, absolutely.
yeah, and it's a great way to leave a legacy behind as well. I think, sometimes I find it, it's definitely a tearjerker when YouTube recommends a video that was like 7 years ago. And then there are people in the comments saying, oh, he's passed away now. And
Yeah,
it's nice to have this video like as a memory of him. And he had some wise words. And I'm just like, oh, that's really sad. And even
yeah,
like lecturers, their lectures from 10 years ago are
yeah,
just fantastic. And, they're happy for them to be posted on YouTube to educate X million people in
yeah,
future.
yeah.
So definitely it's a long term game and people will appreciate it.
No, definitely, 100%.
So, what's your kind of plan for your channel? Do you ever take on brand sponsorships or do you just create the videos for the love of doing it and providing information?
Yeah, I just do what I do, really. Yeah, brands have approached me, and I think there's nothing wrong with getting brand deals and things. I think and if you do, it ought to be something, in my opinion, that aligns with your purpose, um, and and you have to do it with integrity. So you know, I'm not going to do a brand deal just for the sake of doing a brand deal. And if it doesn't fit, then it doesn't fit, and I'll just say no. So yeah, I'm sure lots of people have had brands approach them, but yeah, just a word of caution. I think it's just because ultimately, for we're healthcare creators, and we can't be, and the information that we provide should be accurate, right, and evidence based. So the things that aren't, whatever that brand deal is, just be mindful what you're trying to associate yourself with. Yeah,
Yeah, I think that's really important because you might get that gain now, but it will be part of your brand and your personality forever once it's on the internet.
yeah, no, that is true. So yeah, just be mindful of it, really. I mean, and the thing is, I think YouTube can provide a bit of an income, but I don't
Yeah.
think you know it's you're not going to, well, unless you're Mr. Beast, I guess. You can't probably, you have to have a huge amount of followers to get any decent money, right? I mean, so I'm not sure whether, if you want money, then YouTube may not be the place for it, unless you grow huge. um so yeah, I think just go back to your why, really, and your purpose.
Yeah, I think in a similar way, you don't become a healthcare professional for the money, although some people do, but those are the ones that quit eventually once they realize that it's not really a money making profession. You
Yeah,
really have to love what you do and really, be empathetic towards people and want to actually help them because that's the reason why you're going to stay behind for an hour to write up those notes one day. Or you're going to call someone to say, hey, don't think this is the right thing for you, let me come back to the pharmacy or something like that. It's just really important to want to do something that you feel has impact in the world as well.
Yeah.
and I treat YouTube the same way. So
Yeah, definitely. I mean, I think, there's nothing wrong with getting brand deals and getting paid for stuff. It's just that it has to align with what your beliefs are, right? And
yeah,
things that perhaps I think if you want to endorse something, it's best for you to endorse something that you've actually used, for example, or something that you can confidently vouch for. But maybe that's okay. But yeah, it is a bit of it's a bit of a tightrope, right? And I think you just have to be aware of the potential pitfalls with certain brands that you
yeah,
might want to associate yourself with.
yeah. So thank you for your wise words on that. Um, what do you kind of think in terms of long form versus short form? So, shorts versus the traditional long YouTube video? Because I'm definitely long form person just because you can explain more things, and I
Yeah,
think too much short form content consumption is ruining people's lives. So
yeah.
I don't want to add to that pile. Basically, I want to be stay away from that pile. It seems kind of toxic. So,
Yeah, I mean, it's interesting. Just looking at the social media landscape, TikTok arrived, then Instagram is using um, created reels because of TikTok, and now Facebook's on it, and YouTube created shorts. So there's a big mishmash between short and long. I think um, I think there is a place for both. Um, you know, and it provides different purposes, right? So I think short form content, has a purpose. Yes, of course, it can't break down the minutiae of, I don't know, um, the side effects of yellow fever medication, for example, like what we were talking about earlier, necessarily. But it can provide kind of an overview of certain things. And I think personally, I do think there is an art to creating a very good short form video. I don't think it's that easy, Say if you give yourself a 60-second window and you want to convey something, it's actually quite difficult to make a video that has, that conveys what you want to convey. This is obviously talking about educational videos, in a way that is impactful, but I do think it has its role. Um, but equally, long form content has its role as well. And I think specifically for YouTube, I think short form is the bridge to your long form content. That's how I see
mm,
it, on the platform. So yeah, I think that there's a place for both. One is easier to make than the other, less setup, and yeah, I think it's fun to do both.
yeah, I would agree. I think it's fun to do both, but I definitely have spent as much time scripting a short video as a long video because it's so hard to say in a few words what you want to say, and then you need to think ahead and say, do I make the long video first or do I make the short video first? Because you can do it either way. You can either make a long video first and then find the peaks as to what
Mm,
people find interesting, or you could do a short video and kind of ask people if they're interested in that topic, and then you can make long videos because your short videos have got lots of views. So
yeah.
I've kind of, you know, started off with shorts and then gone more into long form. And now I just, the thought of creating a short is just so much effort. I would just rather put it into a long video.
Yeah, that's interesting. Yeah. Um, I don't know. I think yeah, people some I guess it's whatever floats your boat, right? I think lots of people dread the fact of having to do a long form video because
Mm,
it's just too stressful to talk to a camera or phone, whatever, for X number of minutes, whereas a short form is sharp and sweet and short.
mm.
Um, so yeah, it's fun to do both, and it uh, it lends itself to different parts of your creativity, I think.
Yeah, that's true. I agree. I think having the option to create different formats is also
Mm,
fun as well. Keeps
yeah,
keeps things interesting.
no, definitely, definitely.
Brilliant. Well, any final words or anything you'd like to mention that we maybe didn't talk about?
Um, So yeah, subscribe to Virginia's channel because she needs more than she's got 1,000. Come on, get it, get it. Again, let's increase that. Just so that you can get monetized more and get a proper cup of coffee, because obviously that's quite important. But aside from that, I think yeah, health content creation is definitely something on the move. Um, and when I was creating content many years ago, this wasn't a thing. And now, since YouTube is jumping on board, it is more of a thing, and more clinicians are creating content, which is fantastic. So, if you're wondering whether to do it and try it out, then yeah, I would definitely do it. And there's a great community out there.
Perfect. Thank you so much for your time today. And thank you, everyone, for watching or listening. And we'll see you at the next episode.
Take care.
Bye.
Bye.